Good afternoon, good afternoon, good afternoon. We are talking mental health today. And I have with me Dr. Kenneth Fowler and Dr. Derek Griffith. I always promise that I'm not going to go super deep into all of the intros they can find out online, but I wanted to make sure I said how grateful I am to have you gentlemen here today with us. Both of us have had some offline discussions about mental health. Obviously, there's a lot going on, not only in a global pandemic, but also, in everything that's going on in the world. They're dealing with, just more cultural awareness and destruction of racism, or efforts to destruct racism, ongoing efforts to destruct racism, and everything else. And obviously, as a Black man, this affects us much different than most. One of the things, as both of you know, Black men's health specifically is not just about fitness and how to have rock hard abs and how to have sex all night long, as I said. It's about more than that, and the holistic health and the whole man. So when we talk about mental health and spiritual health, financial health and social health, social well-being, all of those things are very important. So with that, Dr. Fowler, why don't we start by you telling us a little bit about yourself, a little bit about your background, and then we're going to jump into some discussions about mental health and where you think we are today in 2020, and how this is affecting men of color, specifically Black men.
Awesome. I'm glad to be here. Thanks for having me. I'm originally from Dallas, Texas, born and raised. I'm a diehard Cowboy fan. Sometimes I need my mental health checked on how they play sometimes, but
that's right.
But I went to United States Navy straight out of high school, an officer training program that led to me coming to Florida State, majoring in economics with a business minor of all things. And with a few things, the death of my grandfather and some things got me interested in grief and loss counseling, took a course, got involved with a mentor, and ended up changing my complete direction, ended up going to FAMU and getting my master's in mental health counseling. Really enjoyed a marriage and family therapy course that I took in that program that led to me applying to the PhD program at FSU in marriage and family therapy, going there, second year of that program, becoming a certified traumatologist where I work with traumatized individuals, rape survivors, attack survivors, incest, natural disasters, terrorist attacks. That certification and expertise even led to me going to Manhattan 2 weeks after the 9/11 attacks, working with families there. And so I've been working with clients since 1999. I used to work a full-time job, see clients in the evening. And in 2005, I decided I wanted to do what I love, which is therapy and helping families and people find their way, and started my business, Systemic Effects, and have been doing that full time. And that's kind of my story. And so I'm glad to be here, and I like to try to bring as much of my experience and knowledge to the base to try to help people be able to improve their lives.
And thank you for your service, Dr. Fowler.
Thank you. You're welcome.
Dr. Griffith, why don't you go ahead and give us an intro, and then we'll jump on in.
Sure. So I am a professor at Vanderbilt University in a program called Medicine, Health, and Society. I also founded and direct the Center for Research on Men's Health there. And most of our work has been on physical health in Black men, mostly middle-aged and older Black men, but we're starting to do more in the broader sort of across the larger sort of life course of Black males. My training is originally in clinical psychology and in public health, some in public health. I do what I would say is sort of the intersection of mental and physical health, or at least primarily looking, when I talk about mental health, it'll not be quite as usually the severe stuff that Dr. Fowler is going to primarily talk about. I'm going to talk more about sort of stress that's probably sort of lower level stress that we don't tend to recognize as a major sort of factor in determinant of health and those kind of factors, but how stress and how we interpret, how we make sense of stress, whether or not we recognize it as a big determinant of the kinds of behaviors that you were talking about at the beginning, Mr. Brown, which was, you know, the things that we want to do that we're trying to get people to promote to do for their health. A lot of those barriers are related to stress, the things, how we prioritize other things in our lives that can be good things and somewhat paradoxical. So thank you for having me.
Yep. And I'm Jon, not Mr. Brown. I introduce you to my pop at some point. He's Dr. Brown, like you.
Well,
guys,
we're gonna be doctors. We all, so one thing we got to do with Black men is treat each other as equals. So if we're gonna be titles, then you got to be titles, because we don't want to have this here. So
I'll share with the rest of the world. I call Dr. Griffith, and Dr. Fowler instead of Derek and Kenneth on purpose. I was sharing with them a story when I was doing work in Gadsden County back in 2006 to 2008 as public information officer. Judge Kathy Garner, who's now the county judge, was walking down the hall and she had an armed sheriff's deputy behind her. And I said, you know, I nodded, I gave her respect, which I believe in making sure that I give people the respect they're due, hence Dr. Griffith and Dr. Fowler. And I said to the judge, I said, good morning, Judge. And she said, Jon, I'm a magistrate. We've had this discussion before. You know I'm a magistrate. She had on a black robe and a collar. And I said, ma'am, with all due respect, you have on a black robe and an armed deputy behind you. You're a judge. So that's how that works, and me giving everybody their props. And I'm sure people call you other things outside of this session, but I'm going to give you the respect due. So I really appreciate you gentlemen being here. So Dr. Fowler, let's start with you. With all this going on, I mean, you know, even the deluge of media, right, is too much, right? We had Ace Callwood on Tuesday and having a discussion just about even the pressures of people reaching out and checking in, right? They love you, they care for you, they want to make sure you and your family and they are safe, and they absolutely care about your well-being. But there's a lot of stress and pressure in that, and feeling like you need to respond and be able to be a sounding board, or at least help somebody that you love and care for, make sure they can understand and maybe have a view into what it's like to be a Black man in America right now, and understand, making sure they're doing their part in this movement, but also understanding where you come from. You want to be responsible to that. You know, it's a lot. His article started with, we're tired, right? So what do you think? I mean, we're in the middle of a global pandemic. On top of that, people are obviously in the streets responding to systemic racism and other issues that our parents and grandparents and their parents have been dealing with for beyond decades. So talk to us. How does this have an effect on our mental health as men?
Well, I've been saying to people throughout this is that this is kind of the perfect storm. And what I mean by that is that when you have this global pandemic going on, the entire world right now is going through what I consider a low-grade depression, where everyone has been restricted, people are fearful. I mean, and if you want to hike up anxiety, you hike up people's fear, and the anxiety is going right with it. And so overall, we're all, I mean, even when we're wearing a mask, and I may go into an establishment, people are still looking at each other, almost like people are shocked when I say, hey, how you doing? Good morning, through my mask. They're like, oh, we can't still speak to each other. I mean, but there's this overarching fear and anxiety and stress that globally everyone is feeling. And so we sometimes dismiss that as though, oh, well, you know, everybody's going through it. So no, it's still something that negatively impacts us. And then for the Black male to throw on top of it this heightened awareness of social injustice and kind of the sweet spot, if we have any sweet spot of this, is that with everyone being home, more people were able to be present and aware about George
Right.
Floyd's death, which I think played a crucial role in allowing more people to find out quicker. People just right there in real time watching this man's life be snuffed out. That it caught everyone off guard, and now everyone can be mobilized. And so that's why you're seeing such diversity in the marches. It's why you're seeing, people no longer being comfortable being silent. And if I don't have to be at work, guess what I can do? I can go march.
That's right.
And so,
That's right.
so that is almost, that perfect storm has its silver linings in it, but also it raises the tension between races. And so you have some, even between minority races, where people are like, this is a Black thing. Well, then Hispanic people are like, well, we go through that too. And so you have that kind of thing. And then you have where, white people are feeling uncomfortable, that they're like, I feel like I'm being judged. Or I feel like, and so what I encourage people to do is to have healthy conversations, especially when I didn't realize how sharing my own personal stories with the police and those kind of things, how it impacted my white colleagues. Because they were like, well, that happens to people who are, hanging out on the street or who have a criminal record. And I'm like, no. I can give you multiple stories.
Personal testimony. That's right.
And so it resonates with them more. And so I tell a lot of my Black brothers in education and those kind of things, I'm like, share your story, tell your experience, because that's when it becomes real. People recognize this is not just relegated to someone of a particular socioeconomic status or someone who has a particular history with the police. And so,
I spoke the other day, and I have said many times before, it's very relevant, right? We have to make it relevant and relatable, finding that familiarity, especially our white brothers and sisters finding familiarity and understanding, this could be Jon, this could be Dr. Fowler, this could be Dr. Griffith, not just some random them, right? This could be Jon's children. When they see those relationships, those direct relationships, I think it means something different. You referenced something, Dr. Fowler, when you were speaking about the mask and saying hello and things of that nature, right? That in itself is even a discussion, right? We could have a whole nother conversation about mask wearing and things of that nature, especially how politicized it's been. But let's just go back to the specifics of actually wearing the mask and what that means, right? Because pre-pandemic, Jon and Dr. Fowler walking into, my wife and I were needing to get a tent, right? My middle son, unfortunately, like many people, and I'm not complaining because we know people lost greater things than us, even graduates that missed graduations and things of that nature. But my middle son missed a trip to the Rockies that he was really looking forward to. So in the absence of that, we were like, well, we'll get a tent and, put it in the den and all that kind of stuff like that. And we ended up going to, I think, Bass Pro. All right. And here my wife and I are walking into Bass Pro with masks on. And I was just thinking, this is crazy, right? I mean, because, Jon, Dr. Fowler, Dr. Griffith walking into Bass Pro pre-pandemic with masks on. And let me say, I just want to go try to, let me see how these guns, can I see some of these guns? That would be a very interesting discussion. And we know even earlier in wearing masks, there were some reports throughout the country that were having people being targeted or even people being responded to by wearing masks, specifically Black men. So that in itself is a whole nother pressure of, just the world that's going on and those pressures that those are things we have to deal with, right? Those are things that we have to mentally deal with on top of everything else.
Especially people who can't afford a mask or didn't have access to a mask. So they're using a bandana, they're using some cloth. Right. And then you come in and you have an issue with a store owner and you're having some words, all of a sudden you appear threatening, and so those things are we have to be very careful with and cognizant of. And one of the things that I try to help people understand too is that when you're in a pandemic, you know, it sounds good. It's like, yeah, I'm working from home. Cool. I can be in my pajamas. I can do what I want to. But that's cool when I have all my other things that provide me comfort available to me. So when I want to go have a nice meal, I can go do that. Or I can go eat a nice lunch, or I can go bowling, or I can go watch a movie. But see, in a pandemic, all your comforts are taken from you also.
That's right.
And so now, now we are feeling more imprisoned in our home as a result of having to stay home versus this is a plus or a benefit. And so that over time creates stress. And that's why you see people getting out and they're like, you know what, I'm just gonna, you know, if it happens to me, then it happens to me. People being cavalier about it because they're getting cabin fever. And so
that's right.
But it's important to educate. Like there was a story of these two women at a hair salon who had, I want to say they were in Houston, if I'm not mistaken, but both of them, well, one of them definitely had the COVID, knew she had it, but she had to work. And so she wore her mask. The salon, they come to find out the owner had it too, but they both wore masks. They made customers wear masks, and they kept everyone at 6 feet distance. And interesting enough, there were 109 people who they had contact with. They tested
I think I heard that story.
of them, and none of them had the virus. So that lets you know here are two active people wearing the mask, interacting with people who are wearing their mask, and they didn't get the virus. So wearing the mask is an effective way of us getting control of this. And I try to preach it to as many people as I can that the virus doesn't care about your political affiliation, your color, your race.
That's right.
There are almost 140,000 people who are dead in the last few months. To put it in perspective for you, 3,000 people died in 9/11, and we were mortified.
That's right.
And we're exponentially past that.
Yeah. Yeah, that is that number. I think, you know, I always say, especially I'm an engineer by education, so you know, numbers matter. And I know when you put numbers in perspective, it definitely does something to kind of equalize things if you're, you know, making things comparable. But to that point, right, you know, 140,000 compared to 3,000, right? I mean, that's a 40 plus mark, 40 times mark, right? That is right. I mean, I like to make it, you know, make it relatable in the sense of whatever you do, in the sense of, you know, if you drive to work every morning and it takes you 20 minutes to get to the office, imagine that times 40, right? So one day you drive, it takes you 20 minutes from here to there. And the next day, for whatever reason, traffic or whatever, it takes you 40 times the amount of time to get home. That's significant. And that's what people got to realize. And like to your point, Dr. Fowler, these are real people, real loved ones to somebody that in a lot of cases died without those loved ones by their side. So Dr. Griffith, again, just jumping back into, you know, where we are in the state of the world and global pandemic on top of, you know, the social unrest and social awakening and people waking up, you know, again, what is the effect on our mental health on top of everything else that we're dealing with as Black men?
Well, let me continue with the COVID conversation before we switch. One of the things that we haven't paid as much attention to is we know that men are dying at higher rates of COVID than women. And we know that Black people and other racialized minorities are actually contracting and dying from it at higher rates too. Now, the logical assumption is that being Black men, we're likely to be contracting it and dying from it at higher rates than even Black women. We don't have data sources that really allow us to say that. but it's logical to make that conclusion that we need to, as Black men, pay a lot more attention to that. Now, we don't know, there are biological, various psychological and social reasons that we could sort of walk through and so forth. But the point is, it's yet another thing that just by being a Black man, you're at higher risk for. And that from a health standpoint, is a hard message to constantly get, that you just happen to be born, with this particular identity, skin, these kind of factors that for many of us we see as a blessing, and in other ways we see as a curse. But it's something that has implications very directly by simply checking the boxes that we do on forms, has implications for your health that we have to take seriously and take into account. And it's complicated. I mean, to simplify it a bit, how do you deal with that when it comes to all the things that Dr. Fowler is talking about, and just the different stressors, the likelihood you're going to experience these different things are exponentially greater by simply being in the bodies that we're in. When we go into places, you have these things. The reason I was talking about the titles is because that's considered, when you're dealing with particularly interracial conversations, that can be a form of a microaggression. A microaggression is a little small thing that happens that sometimes can be intentional and sometimes it's not, where I refer to you by a title and you refer to me by my first name. And so it's
that's right.
And that's historically been something that we did, or that was done to us, particularly in the South. It didn't matter how old you were, it didn't matter what your status was. If you were an adult of African descent, you were going to be referred to by your first name. And regardless of the age or, of the other person that was talking to you, the white person in this case that was talking to you, you had to refer to them by a title. They had to refer to you by name, and just by your first name. So there are those kinds of things that happen that we have to pay attention to. The stereotypes of being a Black man that are associated with being a Black man, the reason there are gender differences in how we're experienced when we do things like wear a mask, and there's the fears that you were just describing. It's not enough to just look at that as a racial thing. It's important to really understand how that also is different because you're also a man or male. And so how that, and you're presenting as such, which it triggers other people to respond to you differently than if you are appearing to be a woman. So it's important to understand these things, and those all have implications for why Black men tend to die, on average between, about 4 to 5 years younger than certainly their Black female counterparts and their white male counterparts. And we, with the exception of probably Native American men, have the lowest life expectancy in the United States. So there are things that we have to pay attention to that others don't. And that kind of stress, that kind of constant, again, I won't call it low grade, but it's the constant stress that sort of is part of our lives. That is a key part of what we have to pay attention to and contend with. In addition to, we have the pandemic. In addition to, now there's this heightened attention to, Black Lives Matter. That again, the majority of those cases were Black men. Certainly there increasingly we're being made aware of Black women and other racial and ethnic minorities who are experiencing a lot of the same. Legal intervention is the technical term from a CDC standpoint for what that category is. When somebody's killed in the context of engaging with the police, it's called legal intervention. And they actually stopped collecting or stopped presenting the data by certain age categories. I'm not gonna do my conspiracy theory thing, but it is odd. Up until very recently, if you look back at the way that they presented leading causes of death on the CDC website, they presented them in smaller increments. So you could have, birth to 5 to 10, 15 to 19, And in the 15 to 19-year-old age category for Black males, legal intervention has been a leading cause of death for a number of years. You can no longer see that in the most recent statistics, which I believe now are 2017, because there's usually a lag behind. But in 16, 15, and so forth, prior to certain changes in the White House, you could see and track these things were happening. So
Right.
the point is these things are real. Just calling them stress is not a way to minimize them, because a lot of times people, when we say stress, they're like, oh, everybody has stress. That's not a big deal. No. Stress is what'll kill you. Yeah. So we have to really take those things seriously.
And, Dr. Griffith, we've had these discussions, previously, specifically related to COVID, when a lot of the discussion in the media is speaking about these underlying conditions, right? And, I easily say, yeah, you're talking about everything that was already in place pre-COVID, right? All the challenges that men, like you said, just because we were born in this beautiful black skin, just because of genetics alone, in the sense of, like you said, that life expectancy, that hypertension, that diabetes, that, potential to have sickle cell, and on and on and on, right? Being highest levels of many things in many categories that we don't need to be. There are some great challenges with that in itself. But also, we know, related to mental health, I am very thankful that a lot of movements and a lot of discussions have been made, and a lot of discussions have been had to really bring it to the forefront, to make sure that people are more aware and more open to it. One of the things about Black men's health, and I know this is a whole nother discussion, Dr. Griffith, that we'll have to get into at some point, but, I speak about even the relationship with the medical community and the distrust and mistrust based on our parents' interactions, our grandparents' interactions, and those are real, tangible scenarios that they should be, not comfortable with, especially as they are, having their children and their grandchildren move into a space related to medical professionals, right? So if we talk about the Tuskegee experiment, if we talk about, all kind of atrocities, and those are atrocities, not even the subtleties and minor things that we might not even know about, there's a huge amount of distrust and mistrust with that, and that in itself has challenges related to Black men not only going to get medical attention for our physical well-being, but specifically our mental well-being, which for many years has been, and I would say many generations, has been something that has been frowned upon. So, Dr. Fowler, how do we combat that? How do we combat this weakness or perceived weakness if someone is feeling like, because back in the day we could easily just call it like, they're a little off, or they're crazy, or whatever it might be, when we know, that there's more there that we should be paying attention to and acutely seeing if we can provide help. Go ahead. I'm sorry, Dr. Griffith, you wanted to chime in?
Yeah, I just want to jump into something you said early on in what you were just saying, which is a lot of times we look to the reason that Black people are dying is something having to do with genetics. And genes don't, without getting all into this, genes don't express themselves. There are very few things that you die because of what you were born with genetically. Most of the things that you die from as it relates to that are things that have to be expressed. You have to be triggered by something in your experience, in your environment, that makes those things come and have an effect on your health. So it's not just what you were born with, it's what you experience in the world that actually has these implications and why these things matter. So it's not enough to just, and there are a lot of, things people have historically use explanations like the SALT hypothesis, which is the idea that Black people, the reason we have high rates of hypertension and die younger is because we were, the ones who survived, or the ones who survived the transatlantic slave trade and so forth, and that somehow or another means we're genetically predisposed to this, that, or whatever. That's been debunked for years, but it still sort of lives on in our ideas. But I just wanted to make sure we don't sort of perpetuate this myth that
absolutely
biologically inherently inferior about these bodies that we're in. There is nothing that we have found yet that has implications for our health that speaks to why we have the patterns that we do. What we have identified and documented consistently the social experience of how people treat us in these bodies and how we have to navigate these bodies are the things that are more likely the things that are killing us as a result of that.
And
That's good. And go ahead.
That point just right on. It's right on point about it's the nature versus nurture piece, that we have some nature, some natural genetic things, but they can be exacerbated. They can be triggered. Yes. By our nurturing environment or lack of nurture in our environment.
That's right.
To all of a sudden, you know, if you are living in a society where, you know, you are stressed by its environment constantly, that you're walking to school as a stressor, you're going to work as a stressor, you're going to the 7-Eleven as a stressor, then and other people aren't living under that same stress, that stress takes a toll on you. And it also takes a toll on your sense of self also. Because we have little Black boys and girls who are looking at themselves and saying, I wish I wasn't Black. That is extremely troubling, because that means the environment's giving them messages about themselves that make them not want to be themselves. And there's studies after studies of kids giving them even different colored baby dolls, and they choose the white doll. And so we have to stay cognizant and aware of the impact our environment has on us, because it's, and within our own community, we have to recognize when there's dysfunction going on in our community. Growing up, you know, if you're walking down the street, they would say, hey, when you get to Mr. Johnson's house, cross the street. Don't walk in front of his house because he's kind of off, you know? And so, but no one was checking on Mr. Johnson to figure out why he was off. They're just saying, you know, he walks around his backyard in his underwear and talks to himself, but no one's going to say, what's his story? What's going on with him? And so we are getting much better with dealing with mental health in the African-American community. When I started my practice in 1999, I got licensed and started seeing clients. My percentage of African-American clients was probably 1%. About 10 years in, about 2000, it was maybe 5%. Now, my practice is somewhere around 35 to 40% are African-American. Which makes my heart swell with happiness, because I'm like, and I tell people, just get them in the door. If you just get them in the door, they'll see that, wow, this isn't how, you know, because there's so many misconceptions about therapy, about mental health. Oh, that you taking those crazy pills, and you're going to listen to somebody, you know. And I understood the fear that people had of going to talk to a white therapist when you feel like they don't have your best interest in mind because they're part of a dominant culture. I get that fear. I don't think that's accurate, but I think I get why that fear exists. But to be able to walk in and see someone who looks like you and is able to say, hey, I can help you figure out how to live your life in a healthier and more functional way, man. And I learned it from, used to do a parenting class in Leon County Jail here in Tallahassee, about 6 years with incarcerated fathers, teaching them how to reconnect with their kids. And some of the basic parenting skills that you and I take for granted, when I was teaching, they were like, "Well, doc, that'll really work?" I'm like, "Yeah," but if they never had it modeled for them, how would they know it? And so education is key for us to recognize how we impact mental health, how we get more comfortable coming to therapy and talking about things, how we talk about things with each other, and stop ostracizing and making it embarrassing and making it shameful that, you know, you struggle with depression, or you struggle with anxiety, or you have bipolar disorder, or you're schizophrenic. There are things we can do to try to help make your life more manageable.
Do you believe, go ahead.
If I can jump in. Yeah, one of the things that is important to make sure that we don't leave a conversation suggesting that there's often a narrative that being Black is all these negative things. You know, being Black is kind of a wonderful thing. Let me just say this very directly, you know. So I think I'm not saying it from a political standpoint. I'm just saying, you know, at a very basic level, it's important to celebrate the positives of who you are and what makes you and what makes your community strong, and how you survive the kinds of things, the kinds of constant insults, whether they're small or huge. And we get a lot of the big ones in addition to a lot of the small ones. We get our more than fair share of all of those. Yet we're still surviving, yet we're still thriving, yet we're still able to do things and enjoy life and find ways to do those kinds of things. And we have people like Dr. Fowler that if you can't quite manage all those kind of things, you got folks in the community who have your best interests that you can see and deal with those kind of things. But it's important to not sort of reduce Blackness to racism and to just think about all the negatives that come with all the crap that we have to deal with. The other thing the reason that from a health standpoint is important is because there's always been this interesting paradox that Black people tend to have lower at a national level, and I'm not going to get into the methods of how they do this, but for more than 30 years, we've known that Black people tend to have lower rates of anxiety and depression than whites. Yet we have higher rates of physical things like cancer, cardiovascular disease, diabetes, and those kind of things. It doesn't make sense because both of them are affected by stress. And we know Black people, it's hard to argue that this body doesn't somehow or another isn't a magnet for stress. But how we're able to survive and thrive in those spaces and not have the same negative mental health outcomes. Not to say that we don't have mental health issues, is to say that when you look at it comparatively, there's always been this paradox that we don't quite understand. And some of the answer has always been, and quietly, depending on who you talk to, it's been about the strengths of our community, about the strengths of how we're able to come together that have been some of the things that offset some of those kind of challenges. So it's important to kind of recognize that there are also things that are not good for our health that we do that protect those issues as well. But those kind of things are important to recognize too.
Those strengths are so complex, right? We pray that things that we learn from our parents and our grandparents that we could pass along to our children, the next generation. Like you said, Dr. Griffith, in the sense of being resilient, right, being strong, and that has complexities, even potentially in mental health and also in physical health. I'm going to have a discussion at some point in the very near future with some dentists, right? And we know because of education and awareness that heart health, there's a direct correlation, connection between heart health and dental health, right? We know that because we're educated and we've been exposed and things of that nature. We need to make sure people have more awareness of this. We also know, again, because of that strength, and I speak about that. If you go back to my dad was born in North Carolina, right? So if you go back to his granddad and his dad and things of that nature, and I'm speaking specifically about dental, think about it, right? My dad's granddad, and he is in the field or in a factory, and he has severe tooth pain. How does he react compared to me today, right? His reaction is more so almost not proactive, but reactive, in the sense of it would have to be excruciating to the point where he probably couldn't function to remove himself out of whatever capacity he was in, because that would affect so many different things in the sense of economics and all kind of other things, right? Which could turn into social and mental and other things, right? Whereas in today, my son could come to me, and again, I have 3 boys, so absolutely, if somebody is sliding down the driveway or running their knee up against asphalt, which I say is a good lesson to learn, that you don't like that. That's not a good connection, your skin on asphalt. We want them to be strong and get up and wipe the blood off and things of that nature. However, if somebody's talking about their oral health and something's going on, or there's a tingling on their left side, I'm immediately paying more attention to that. That's not, hey, suck it up, things of that nature. But it's easily understandable how my granddad or my great granddad to his son or his grandson could easily be like, what's going on with your boy? Because in his experience, right, he was almost at just a deafening pain threshold, and he still went to work because that's what he had to do, not understanding that where we are now, we could easily understand, well, hey, I have dental health, hopefully, prayerfully, I have dental health care and things of that nature, and there are more signs to tie in that this is something more severe than just, just ignoring it because of other factors that I need to ignore in the moment. There's a lot of physical and mental things tied to our machoism and egoism and that strength, that same strength that makes us so resilient and as a people also has such damaging, other complexities related to mental and physical health. Go ahead, Dr. Griffith.
Well, I know Dr. Fowler was trying to get in here too, so let me go ahead.
Please.
I heard from you in a second. Yeah.
Well, I always tell people there are 3 letters that have killed more Black men than anything out there. And those 3 letters are EGO, our ego.
That's right.
Not taking into account that we are fallible or that we need to take better care of ourselves. I mean, and look, I'm guilty of it sometimes where if it wasn't for my wife pushing me to go do certain doctor's visits and those kind of things, I wouldn't have realized, whoa, I have sleep apnea. I need to address that. That for years, I didn't address it. I was like, I just snore loud. That's what it is, and so
right.
So it's important that because as men in general, we don't go to the doctor as often as women, but when we do go, we're sicker than women. Why? Because we sit with our disease or our illness longer trying to tough it out, or I don't need that.
Right.
And that impacts, and as Black men, we have to think about how that impacts our families. That if we're putting ourselves at risk health-wise and could cause us to be taken away from our families, we're doing more damage. And so it's an important piece, and that goes with mental health too, that if I know I have an anger issue, if I know that, I suffered some childhood sexual abuse and I don't like talking about that, I don't want people knowing about that, but I know it's impacting the way I interact with my wife or interact with my lover, or it's eating at me and makes me, angry, then you need to go see somebody and deal with that. I mean, that therapy confidentiality is real in therapy. That I love my license. If I go and share anything, as Jon knows, I see many prominent people in our community, you wouldn't know it because I don't talk about it. I can't share their information. If I do, they can turn around and sue me. And so confidentiality is real. Your information is private. And there was a gentleman that had a question in the question and answer.
Thank you. Yeah.
That was asking, he was talking about Dr. Griffith's point. He said, what strategies are typically successful in convincing a Black man to choose to get help when we suspect they need it? We want to thank Kelvin McDaniel for that question.
KJM, hello, sir.
Well, did you want to
go ahead?
Dr. I was actually going to ask Dr. Fowler to see if you wanted to jump in and respond more directly to that. I know you kind of touched on it a little bit, but I want to elaborate.
Yeah, one of the ways of getting people to go to therapy is saying, I'll go with you. Because sometimes it's an unknown, we're fearful. We're like, look, man, my wife and I went to therapy, even talking about the fact that you've gone to therapy. See, when you get rid of that stigma, when you get rid of that shame that comes along with it, I tell people as a therapist, I've gone to therapy because I believe in what I do. So I'm not, if I believe that I can't be sitting in the seat that my client is sitting in, I don't need to be doing this work anymore. And so the thing is I have people who come to just improve their lives, to get an objective opinion about how they're going about. I have CEOs of companies come and see me. It's like, look, I need somebody to tell me straight. You know, I pay all these people. Of course, they're going to agree with me, and I need someone to help me say, "Hey, no, that's a crazy idea," or "You need to do better. That's not the way you should handle that." And so, those are things that we need to talk about it more. We need to, if a person's worried about, say, "Look, man, I'll ride with you, brother. I'll ride with you," but you know you got a problem. You know this. If you don't deal with this, it's going to end up being a bigger issue. It's going to impact your job, your family, all that. I love you, brother. I don't want to see you go down like that. So let me go with you. I'll ride, I'll drive. You ain't got to tell me nothing about it. I'll ride, drop, wait in the parking lot, and then when you're done, I'll take you to the house. You know, but
Right.
that kind of support and that kind
Support.
of understanding about it's okay. Because for years, those years when I only had 1% African American in my practice, I'm watching people other than my race come in and get help, improve their lives, reach their goals, heal their wounds, work through their pain as a kid, and all of those things. And I see my people suffering and unwilling to come in, you know, and thank goodness the church has become more open to advising people that therapy is okay, you know, because you know,
Right.
I have preachers that come see me. They're like, look, I need somebody to talk to, you know, and I've been praying till the knees and my pants are gone and nothing's changing. And so
Right.
there's a spiritual, there's a physical, and there's a psychological part of your body you have to take care of. And
That's
so
right.
I tell people, who do you think I work for? You know, I don't work for the devil, so I'm here to do something for a reason. And so it's important that we get rid of that stigma, we continue to talk about it, and we support people who need the help. And just even sometimes doing interventions. I tell families all the time, just if you see a family member that's out of control and they need help, everybody needs to sit down and say, look, we love you. But if you keep living your life the way you are, this is not going to turn out well for you, and we're not going to continue to let you sabotage our lives and do the things you've been doing. Have a good
Yeah.
balance.
Yeah. A lot of times men do.
Dr. Griffith,
Yeah. One of the things, just to, I mean, I can't agree more with everything Dr. Fowler said. I mean, the only thing I would just add is we know that a lot of times, again, there's interesting paradoxes for me in Black men's lives, that a lot of the things that we're trying to do to be successful or to be good Black men, meaning that you're trying to go to work, you're trying to put food on the table, you're trying to contribute financially to a household,
that's right.
trying to be an active parent, not just sort of, drag yourself in there. Those are actually the things that may make you say, from a very practical standpoint, yeah, I know I'm limping. Yeah, I know I got this pain. Yeah, I know my heart ain't feeling right, but I got to go to work because at the end of the day, they need me to help put food on the table. But
That's right.
so we'll suffer through these kinds of things. I use the analogy of John Henry, the story that, certainly most Black people know of, sort of this fabled character and so forth. And we often miss the point of that story, which is, if you think of it and you take it out of context, he was considered, one of the strongest people that ever lived. He was one of the best at his job, which is why he was able to race the steam engine and boring holes through a mountain and trying to do all that kind of stuff. And he was successful because he won and was actually better than anything out there at the time. But the problem that we kind of miss is he died at the end.
He died. Exactly.
Prematurely, right on the tracks. And so we're willing to do those kinds of things for similar reasons. We're willing to work ourselves to death. And I'm very guilty of this myself, but I'm trying to work through it. But we are more than willing to sacrifice our health for things like work. We're more than willing to sacrifice our health for things that are good things. Nobody's going to say to you, at your funeral and stand up and talk about, if he was a good, tried to help provide for his family, was very active, burned himself out and whatever, they're going to see that as a good thing. We value men who do those kinds of things. The problem is we make these false choices that taking care of your health, and particularly in this case, taking care of your mental health, is not as important as taking care of your physical health. And that
balance.
That we've got to, you know, we've got to do better at not making this false choice. If you need
false choice.
Look, one of the things that's the difference between men and women's rates of going to the doctor is not, women don't go to the doctor as much as they're supposed to either. Let me be clear about that. Particularly if they're symptomatic. So when there are symptoms, men and women go to the doctor about the same rate. Where the difference between men and women and going to the doctor differs is when it's preventive. That we don't tend to go to the doctor for just regular annual visits, checkups, and those kind of things. That's what women do at higher rates than men. And this is not unique to Black men. This is actually globally. They've done systematic reviews that have shown this globally. That's where the difference is. But when you have, again, if you have a single mother or a busy working mom, she ain't going to the doctor if she feels a little twinge and pain and, you know, headache, tooth pain, whatever, wherever it is. If she can kind of ride it out and suffer through it, she'll do it too. So there's nothing special about that, but we internalize it and make it a gendered thing, but that's just an adult thing. So we recognize that these things are not, my point is, it's not always to demonize. You can't always look at this through a negative lens. We need to recognize that we're trying to do good things, but sometimes prioritizing doing those good things can actually be the things that are harmful to your mental and physical health. So you gotta step back and prioritize and balance and have people in your life that you can share these kind of things with. Because a lot of times men suffer. One of the things we know is that particularly when we get to middle age, a lot of times men suffer in isolation. We're afraid to tell men, this is actually a version of what Dr. Fowler was just saying. A lot of times we'll assume that we're the only one who are experiencing this particular thing. We're the only ones who are stressed with this. We're the only ones who have experienced that kind of trauma. We're the only ones struggling to manage all these kind of things. Everybody else seems to be doing all right with it. Why am I the only one struggling? Not, it's just that you ain't talked to anybody to figure out they're struggling too.
Yeah.
It's just that you just don't know how much they're struggling. And so it's actually have those conversations and build those relationships and nurture those relationships with other men. I'm not talking about feel like you got to sit down and kumbaya and whatever, but you know, when you're getting together normally, open up and start to have real conversations with your male friends or with whoever friends you have, and be open about those kind of things. And you will be surprised at how many times you will be, you know, to again, Dr. Fowler's earlier point, that they will recognize, yeah, man, I'm dealing with that too, or I did that. Well, the reason you seem to me doing better is because I went to Dr. Fowler and checked him out.
That's right. That's right.
Let me get through this. And so you have these kind of things that we can do.
Yeah. That point you just said, and I was about to ask Dr. Fowler earlier about, again, I speak a lot when I have written in the past related to Black men's health about that relevancy, right? Making things relevant, right? Dr. Fowler, do you believe that you've seen that uptick, that, you know, positive trend in your clientele related to Black men, specifically based on relationships? I'm hopeful, right? Even more people seeing and hearing this in the sense of, oh, I might need to talk to that cat, right? Or I might need to find somebody in my community, or maybe Dr. Fowler knows somebody in St. Louis or San Diego that I can go see because I'm more comfortable. I believe that relevancy is so important, right? The way I got to you, obviously I know you from other things in, you know, in the community and things of that nature, but me texting a couple of people, making a couple of calls, did the same thing with Dr. Griffith, asking people specifically about professionals related to mental health, and your name came back more than once, right? So somebody that I respect, somebody that I'm close to, that's saying, hey, Dr. Fowler, Dr. Fowler, Dr. Fowler, that's important to me. And I think that's very important to other men as they're looking for this, in the sense of, okay, I feel more comfortable because I know him, I respect him. It's more relevant than just some random dude that I'm picking out of the white pages or the yellow pages.
Exactly. One of the things is making it a personal experience. Like a lot of times people have this vision, and television doesn't do any favors for therapists the way they depict us in movies and different things like that. All kinds of unethical things going on, or unapproachable, or you have more issues than the client, and all kinds of things. And so,
right.
But the thing is that's why I say just get them in the office, because I'm real, I'm personal. I don't sit there with some God complex, like I got it all figured out or my life is perfect. I'm like, look, you got to be intentional about your life. You got to be, and my wife says I share too much, but I'll tell my own personal issues, and I'm like, hey, my wife says this about me, so I'm working on this particular thing, So
Transparent.
it's relatable, it's real, and they recognize, wow, this guy just like me, And so when you feel that, and that's why I do these kind of things, and try to talk to people in open forums, because I want them to see that this is not some scary monster or something. I mean, look, I'm just as real and down to earth and have issues as you do, and I have some tools and some information that I can help you learn how to do things differently. While I love my parents, and I feel like I have a great role model of parents, but not everything that they did is applicable or healthy for today. And so
Right.
I'm willing to analyze that and look at that and say, you know what? Because I tell people all the time, we come from our family of origin with a toolbox of tools to live life with. And some of those tools are really good tools that we can use. Some of those tools are outdated. Some of those tools are rusty. And in some of our toolboxes, tools are missing altogether. And so coming to therapy, my goal is to help you fix the tools that need fixing, help you better use the good tools that you have. And if you're missing tools, help you learn those tools so that you walk out of my office and you feel competent and capable of dealing with issues in your life and moving forward. And that's really what it's about. And so when we start taking, I tell people all the time, the number one trait of a good caregiver is how well they take care of themselves. Because if we're the caregivers of our families, if we're caretaking, then the better I take care of myself, the better I can take care of my family. Because this engine's going to be strong, and it's going to be well tuned and well fined and well lubed, where, hey, it's going to function. It's going to do the best job it can.
That's an exercise in itself, Dr. Fowler, right? I mean, that's an exercise in discipline in itself. I mean, especially when you're doing your best to, just excel, right? I mean, again, Dr. Griffith is a director, of a center. You're a CEO of a company. There's no, it shouldn't be lost on us that, we as men, and specifically Black men in 2020, sometimes we are still the first of, right? So sometimes, as I know, sometimes you see that little crack in the door, we don't tiptoe into it. Usually we just blast through. And some of these things that other communities have baked in, we have to be very disciplined and intentional in working to bake those things in. If they were not baked in, like you said, they were not in our toolbox to begin with. We have to do that for ourselves and our families. I always promise that I try to end this thing at an hour. If you all have a couple of minutes, and if we have any questions, people can raise their hands. If you guys got a couple of minutes and you don't mind, we can take a couple of questions. But I truly appreciate the time and the expertise and the experience. I thank you, Dr. Griffith, for chiming in on that piece about genetics. There's a lot to learn and unlearn. I know we need to come back and have that discussion about mistrust and distrust, because I know I'm using that wrong, and I know that's a whole discussion in itself. Dr. Fowler, if you will continue to make yourself available, I'm sure that we can have some continued discussions on this. I know this is very important in our communities, young and old. So if we can make sure that it's more relevant to men in our communities throughout the globe, throughout the world, I'm sure we can help a lot. So let's take a question real quick, and then we'll wrap this up. I think that might be. Oh no, I think they just said great discussion. Yeah, just great discussion. So, gentlemen, I tell you, we are going to have. I know everybody cannot make a noon time. We have on purpose. We call this the summer lunch series, so we can kind of stretch this out during the summer, and people can take a little break during their day wherever they are to get some insight and hear from some people. Everybody doesn't have to be an expert. So while you all are experts, we're going to have some non-experts on here also, but they're experts in life because they're living the experience, realizing everybody doesn't have the opportunity to make noon. We are going to have some evening activities. We're going to start on Monday, July 6th at 7 p.m. have some runners coming on. Reginald Harrison is in Atlanta. Sabrina Watkins is in Texas. I might be saying Dallas. I might be saying that wrong. Who ran in school, and definitely, as she said, her first love is running. And also Mr. Keenan James with Black Men Run, something that I've been involved with and have followed, and definitely encouraging and inspiring a group that collectively is assisting and encouraging men to run. I am a baby runner, as I call it. That's a whole story in itself, about my wife dragging me out in the street at a turkey trot one year. So I'm a wannabe grown up runner. So we're going to have a discussion about running, and we'll continue this discussion again in the sense of holistic health for men. So Dr. Fowler, Dr. Griffith, we thank you all for spending some time with us today. We have you ask that you stand by, and we continue to have some continued relevant discussions. All right.
All right. Thanks for having me.
You all stay blessed and stay healthy. All right. Respect.
Thanks.